Good morning. Thank you guys all for being here. We're going to be doing a press conference today regarding the recent overdoses in Lincoln. Captain Ryan Dale of the Narcotics Unit will speak first. Second will be Director Pat Lopez of the Lincoln Lancaster County Health Department, followed by Topher Hansen of Centerpoint. And we also have available for questions Chief Jackson. We have LFR personnel, Chief Engler, and Pat Condon of the Lancaster County Attorney's Office. And with that, Captain Dale.
Good morning, everyone. Thank you for being here. We've really been trying to push this message out about the dangers of the illegal drugs, and especially the drugs that we're seeing right now in Lincoln. So we appreciate you being here and helping push this story out. Absolutely any help that you can provide us, we're extremely grateful for. In 2020, Lincoln experienced 133 overdoses. That was a 76% increase over the previous 5-year average. As concerning as that was, we have already surpassed that in 2020. We're sitting at 141 overdoses in 2021, and we still have over 4 months to go, of course. We have seen 50 overdoses in Lincoln in the past month. Over half of those required Narcan, sometimes multiple doses, in addition to CPR and other life-saving measures to revive the victims. Tragically, 4 of those victims did not survive, and 1 more is expected to die. And even more tragically, 1 unborn baby that was in the 3rd trimester did not survive. Throughout the past couple years, we have seen methamphetamine, heroin, and counterfeit oxycodone pills that all contain fentanyl. Numerous overdoses have occurred due to the users not knowing what is contained in those drugs. In the past few weeks, though, a trend that is new to Lincoln of fentanyl-laced cocaine has devastated our community. At least 26 of the overdoses in the past 3 weeks have been caused by this cocaine with fentanyl in it. One can never assume that any type of illegal drug does not contain fentanyl, and as little fentanyl as the size of 1 grain of salt can cause an overdose. The Lincoln Lancaster County Narcotics Task Force has been working around the clock, investigating every single overdose. We have conducted interviews, analyzed evidence, served search warrants, and made arrests with the goal of stopping the overdoses as soon as possible. We investigate overdoses for 3 primary reasons. First, to hold the people providing those drugs to the victims accountable so they can't provide drugs to others, leading to more overdoses. Second, to search out and seize remaining drugs so those drugs cannot cause additional overdoses. And third, to provide information on resources to the victims so hopefully they don't continue to suffer from the effects of drugs and potentially overdose again. We are blessed with an incredible community full of wonderful people. We recognize that some of our citizens suffer from various addictions or have friends and families who do. There are many resources available to help. Recently, the Health Department started an overdose prevention website that is an outstanding hub of resources. It can be found at lincoln.ne.gov, keyword overdose. It's time to band together and stop the suffering that too many of our citizens are facing. We encourage anyone with information regarding individuals distributing illegal drugs, especially drugs that have led to overdoses, to call the Lincoln Police Department at 402-441-6000, the Lincoln Lancaster County Narcotics Task Force at 402-441-8181, or Crime Stoppers at 402-475-3600. Together, we can make our community a safer place. I'd like to now introduce the Director of the Lincoln Lancaster County Health Department, Pat Lopez.
Thank you, Captain Dale. We've been working closely with the Lincoln Police Department and Lincoln Fire Department and other partners in the community. We are extremely concerned, and due to the seriousness of this situation, the Health Department will be issuing a health alert that will go out to the community. We are urging the public to know the signs of an overdose, and if you know someone who is struggling with addiction, we want you to be prepared with life-saving rescue medication. Naloxone, also known by the brand name Narcan, reverses the effects of an opioid overdose. It is safe to use, and it's available to friends, family members, and loved ones of people struggling with addiction. Several pharmacies in our community provide this free. These include Hy-Vee at 50th and O, Kohl's Pharmacy at North 27, and USAFE Pharmacy in Waverly. It's important to mention that Nebraska state law exempts bystanders administering naloxone in good faith to save a life from any civil, personal, or criminal liability. For more information on overdose signs and symptoms, life-saving measures, and other resources, go to lincoln.ne.gov/OD. The Health Department is also leading a group that includes community members and more than 20 of our Lincoln organizations that are working together to reduce opioid and other addictions. The Opioid Overdose Prevention Coalition provides consumer and provider education and advocacy through collaborations in treatment, reducing stigma, and prevention education. Now I'd like to introduce Topher Hansen, the Chief Executive Officer of Centerpoint, who's also a lead member of the coalition.
Thank you, Pat. Centerpoint exists for a full continuum of care in this community, and treatment is certainly a part of that. So people wrestling with mental health and substance issues then can seek out outpatient or residential treatment at Centerpoint and other organizations in the city to help deal with some of the addiction issues they're wrestling with. But the other piece that we offer is a crisis response team and an outreach team. So the outreach team is out on the streets every day, working in downtown and throughout the city to help people who are in a homeless situation find resolution to that and get the care they need. The crisis response team has a 24/7 hotline at 475-6695. We also have walk-in availability at 13th and E Street during business hours that you can walk in and talk to a crisis counselor. And we do respond with Lincoln Police Department and in other situations as needed in the community to help people who are struggling. This is a crisis response team. What you should know is, as Pat mentioned, these teams carry Narcan with them at all times. You can carry Narcan with you at all times. You can go to these locations that Pat identified if you have a loved one who's struggling with this addiction. So to set yourself up so you don't have loss of life is important. The drug that we're dealing with here is a powerful, powerful drug, 50 to 100 times more than morphine. And what happens is people lace that with cocaine, which makes you go up, and the fentanyl makes you go down. Ages ago, they called that a speedball. Today, why people are lacing it with fentanyl, I don't know. But what I can tell you is just the grain of sand is too much. So when you think somebody's tossing you a tennis ball, turns out a wrecking ball is coming your way. So you need to protect your loved ones. You need to protect yourself. If you find yourself in that situation, obviously 911 and getting the emergency medical system employed is a critical factor because your life can be lost quickly. And for the loved ones in the family to be able to have conversation about this with the person who's struggling, to let them know what the lethality of this is and the danger is important and hopefully can save lives. We want to save lives. We don't want people dying from this mixture of drugs. And if you have that struggle and are sort of up against the wall and don't know what to do, call the crisis response team. We can come out and talk to you. We can get you connected to activities that will get you through this addiction issue through outpatient treatment, residential treatment, and other things. So use the resources available. More than Centerpoint, we have all of our programs have Narcan available, but the Bridge Behavioral Health also has Narcan, as does Cedars. And so if you're in a situation, know what your resources are. Probably your fastest is going to be the emergency system, or if you have it in your possession because you know you have someone in your family who, or a loved one who is struggling with that addiction. With that, I'll open it to Chief Jackson. Did I just promote you?
No, I think that covers it for another week. Good morning. Just a quick overview. This is not a problem unique to Lincoln. The DEA has just recently, in partnership with the Omaha Police Department, Nebraska State Patrol, and ourselves, put out a flyer, again, cautioning citizens of Nebraska of the dangers of fentanyl and fentanyl-induced or laced drugs. This is a national issue that has come to light in the city of Lincoln. Overdoses are not new to Lincoln, Nebraska, but the severity and the numbers are. We have people dying from this, and while it may not impact you directly, secondarily through friends, through family, through coworkers, or whatever your association is, there's an impact to the city of Lincoln. As all of the speakers before me said, our goal here is the preservation of life, and we want to make sure that our citizens are safe, and we want to make sure we are alerting you to this threat, and that is our purpose today. There are protections for those that call us. The legislature and the governor in 2017 signed into law 28472, which allows for individuals that report overdoses to law enforcement or medical personnel to be exempt from many of the prosecutions available under the law. And we strongly suggest people call us at the earliest that they can, so that life can be saved and preserved, and that's our goal. And as we continue to this, you can see we have a strong partnership through the health department, through the fire department, through the prosecution available through the Lancaster County Attorney's Office and the courts, as well as our service providers of Centerpoint and many others that are scattered across the community. We are one in trying to educate, inform, and help save individuals in our community that may be impacted by this fentanyl risk. So with that, I think we'll open up to any questions. So,
do you have any idea why this has come to Lincoln now?
As Captain Dale indicated, our investigations start at the level of the overdose, and then we start going up from there. And we have identified the sources of a number of our overdoses, but then you have to look at where their sources come from. And going up that chain takes time. It takes time for the state lab, who's been very much a partner in this and expediting our desires for drug tests, which normally take more time, but they've been expediting it based on the dangers that are here. But we have to know what we're dealing with. White powdery substances could be any number of things in our world, but it appears to be a regional issue. Omaha's experiencing the same things, and again, as we work up those chain, we try to identify those sources, and once we do, we'll have a better understanding of that.
Do you know how many arrests you guys have made? I know that you guys announced, I think, 2 on Monday. How many have there been?
We've made, I don't have an exact number for you right now, but we've made several arrests off of search warrants that we have served during the course of this investigation. Those people that we've arrested may or may not be involved in actually distributing the drugs that were overdosed on, but at the very least they've been on the peripheral of this investigation and we've found significant amounts of drugs in their houses during the course of this. But as far as providing details as far as the level of their involvement in it to protect the integrity of this investigation, I really can't go into detail about that right now.
Do you face like a higher level of charges if you are found to have provided drugs that led to an overdose or an overdose death?
There is a federal crime in the federal court system that prohibits providing drugs that lead to serious injury or death. And all of these overdoses would constitute serious injury because they've all required life-saving measures. They've all required hospitalization. And, of course, some of them have led to death. So we've not charged anyone in these cases yet in the federal court system, but there's certainly potential for that moving forward.
You may not be able to answer this, but do you think that there's a lot of different drug dealers putting this out into the community, or do you think it's like, like one maybe?
Well, how these things tend to work is kind of like a family tree, if you can picture that. One source provides it to a couple people who then provide it to a couple people each, and before you know it, you have 26 people overdosing on it. So I would say there are certainly more than one person involved in the chain of this.
Have the people that you've arrested, have they been cooperative in terms of helping you kind of like climb up that chain and try to figure out that family tree where all this stuff is coming from?
That's probably not something I can comment on, again, to protect the integrity of this case, as well as to ensure that they receive a fair trial themselves. Andrew?
Yeah, maybe you guys can answer this, but issuing the public health alert, what does that do? What does it, besides just drawing more attention to the situation?
Well, we issue advisories. So to give you an example, recently we issued an advisory about the smoke coming from a burn-off and some other fires. That's an advisory just telling people, be aware this is around, it may happen. When we issue a health alert, that means we need people to take action, that we have a serious threat going on in our community. We need everyone to know and be prepared to respond. So that's the importance of the health alert.
What action would you want Lincoln people to take?
I think the things that we've all discussed, from Captain Dale to Topher and Chief Jackson, and saying we want people to know this is there. We want them to know that Narcan is available. We want family members who have a loved one who's struggling, be aware of this, inform them that this is happening, get the news out in that way, and know what the resources are, and be able to have the Narcan available. And all that will be detailed in the alert that's coming out and about what we can do, because there are things we can do. And we're very fortunate that our community has resources available. As Topher was talking, there's a 24/7 line. That's not just for those individuals, but it's for family members that need to know what to do in responding to the crisis. I mentioned we're working with over 20 partners in the community to provide resources and strategies for prevention. So those partners include all our health systems, Topher, Region 5, and as well as we have family members and other community members who are helping us develop strategies to move forward, and that's really critical.
I guess with the threat of maybe sending a mixed message, but can you self-administer Narcan? And, do you recommend, if you are doing it, that you do a buddy system where somebody has Narcan available,
I think I'm going to let Chief Engler answer that. I think, having a buddy system there, from my background in nursing, I would say is important. But I think when you're in the throes of the overdose, I'm not so sure how well you can assist yourself. I really don't think that's a feasible option.
I have a question for Chief Engler. Just what are EMTs seeing? How is LFR responding to these type of calls?
Well, traditionally, what we found is you'd have an individual overdose, and our typical medical response was appropriate. But what we're seeing is groups of people at this point in time. So what we're having to do is send a lot more units. You know, when people are in this critical type of emergency, it takes about 6 people to resuscitate them. And we're responding to groups of people that may be 2 to 4 people that are overdosed. It's not likely that a person could give themselves Narcan, so I don't want anyone out there to have Narcan in their pocket and think, oh, I can do this, because they decline rapidly. And what's amazing is these drugs affect people differently. So you can have people that are unconscious and not breathing, and other people that are standing there calling 911, and in about 5 to 10 minutes, then they're going down. So we have had that experience numerous times. So we are changing our response. And the other thing to think about is if you do self-administer Narcan for somebody, that Narcan is going to wear off. So you need to call 911. And if someone does go unconscious, you need to call right away, because the clock starts ticking. And Narcan doesn't work hours later. So it needs to be administered right when the person stops breathing before it's going to be effective. So we've experienced a couple of cases where people have delayed calling because they didn't want to get in trouble and they thought things were going to work themselves out. That is not the case, and so time counts in every instance. So make sure if you do experience this, and that can be altered level of consciousness, difficulty breathing, respiratory arrest, any of those things, call 911 right away.
You might talk about the multiple use, the multiple dosages of Narcan to counter the fentanyl.
Yeah, and that's what I was kind of talking about. The fentanyl requires a lot of Narcan, typically more than what we've seen in opioid overdoses in the past. So those, single use Narcan, it may bring someone who's not breathing back to breathing for a temporary amount of time. On our units, our paramedics carry a lot of Narcan. So and we have to multiple dose these individuals with more than what is typically what we experienced years ago. So that's why it's increasingly important that we call 911 even if you have your own Narcan.
How seriously injured or sick are the patients that you're seeing who've overdosed on fentanyl?
Well, many are in cardiac arrest, and it doesn't get more serious than that. Several of them are in respiratory arrest, so they're just bordering on cardiac arrest. So these are serious patients. These patients will die if there's not medical intervention. And as Captain Dale said, we've had people die because they didn't get medical intervention in time. And that's why I'm really stressing calling 911 immediately.
What are first responders doing to protect themselves if fentanyl is present?
We're all wearing, all our crews are wearing protective equipment. We're not only doing that, but for COVID. So our emergency responders have a number of different risks that they face every day. So, gloves, N95 masks, or surgical masks, depending on the type of call. Those are the typical levels of protection, eye protection that we're doing, and we've got suits we can wear too if needed.
So if people call and they were to encounter a drug laced with fentanyl, what do they need to do to protect themselves from not getting in contact with it?
Stay away from it, and we'll take the necessary steps to cordon off the area and have it disposed of if needed. It's technically a hazardous material at that point.
And this might be a question I'm not sure, but how do you guys identify whether a drug has fentanyl? I mean, we're talking about fentanyl overdoses. Is there a test for that, or is it just...
We don't have any way of doing that. We go strictly by the patient. And, if we have an unconscious patient and we give them Narcan, we can tell. But we don't have a test kit that provides us that information.
Chief, would you touch on the fact that this stuff can absorb into the skin? So if you touch it,
yes.
So family members and bystanders and so on.
And much like I just said, for all intents and purposes, this is a hazardous material. It's no different than acid or whatever. It's absorbed through the skin. It can be inhaled, so it's very dangerous. And like it was pointed out before, it's very small particles can cause problems. So these things absolutely need to be treated like a hazardous material. And if you experience anyone that's unconscious for an unknown reason or anything like that, 911 should be called, and we as responders look for those signs and take the necessary precautions.
Can you walk us through, you said that there were multiple people that were in distress. Can you walk us through maybe one of the, something that you guys saw recently or anything like that about, when they came into a scene? What did that look like?
Well, I think in one recent case, we had one person in cardiac arrest. We had another individual in respiratory arrest, so we had two individuals there. We had one person that was asymptomatic, and one person had left the site before 911 was called. And so our responders got there, and we had multiple units working the cardiac arrest, the respiratory arrest. They put one of the asymptomatic individuals in the medic unit. That individual ended up going into respiratory arrest, and we were looking for the other individual because we were concerned about that individual, and they were found in respiratory arrest a couple blocks away. And that's what I'm talking about, the differences in how the drug affects people. There's a delayed response, so you may think, oh, I'm okay, and that's just temporary. So it's just vital that people call 911.
And Captain Dale, in any of those cases that you guys have done, have you seen any Narcan in the homes or in the residence at all?
In the recent ones, I'm not aware of any cases where we've seen it in the homes. In previous cases with like pressed fentanyl pills that are made to look like oxycodone, or meth that's laced with fentanyl, things like that, heroin laced with fentanyl, or heroin itself. We have seen a number of cases where friends or family have administered Narcan, and thankfully they've still called so they can be taken to the hospital to receive additional treatment, because as Chief Engler said, that Narcan will wear off.
Last time you guys briefed on opioids, you talked about how Narcan is kind of spread out throughout LPD in different shifts and in different units, but not every officer has it. Are you guys taking steps to make sure that more officers have it so they can provide first aid?
As of right now, we have actually very good coverage, all shifts, all parts of town. We have it in each of our stations, everywhere where officers tag in evidence. All our canine handlers have it. It's spread out very well, and we've not experienced any instances where had an officer had it that didn't have it, they could have saved someone. We've been able to have officers present at any of those scenes in time to administer it.
The last time we talked about this, we were mostly talking about pills that people maybe thought were some other kind of opioid, and now recently the fentanyl-laced cocaine has been an issue. Is that something could it being in cocaine be a driver for this increase, or are you still seeing like a mix of substances?
Well, I think it being in the cocaine is definitely the driver of the recent batch of overdoses. We haven't seen this in Lincoln before. They have in other parts of our state and certainly other parts of our nation, but it's something new to Lincoln. And people who are maybe regular cocaine users aren't someone who's maybe a heroin user might anticipate and be prepared for this sort of thing, where cocaine users hasn't crossed their mind. So that's definitely hurting us.
I have a question for Director Lopez about how we can destigmatize conversations about mental health, approaching someone who may be experiencing issues that lead them down this path of drug abuse and overdoses. How do we stop the problem before it starts?
I'm going to ask Topher to join me because of his expertise in this area. But one of the things that we're focused on, of course, is the prevention and early intervention treatment. So I think the more we get information out into the public and the more we have acceptance and provide and talk about this, just like we talk about diabetes or somebody having high blood pressure, makes a huge difference for individuals, not only in seeking the help that they need when they need it, but also for us to make sure that we have those resources available to help people. And I think Topher can add some additional information.
So if you look to many of the people who are involved in addictive drug use, one of the things that you find is a majority of the time, a vast majority of the time, you'll find some underlying issues that go along with that. And most notably in what we see, of the over 4,000 people we saw last year, anxiety and depression were the two mental illnesses that were most prevalent. And often with that is a substance use issue, and it can be cocaine or it can be many other drugs. So the driver in all this is there's something going on in the person's life that is causing them to be anxious or to be depressed. It can be life events. It can be wiring, what they inherited as a gene. It can be all sorts of things. And what happens often is people don't set out. There's nobody who sets out to say, you know, I'm going to be an addict today. I think that would be a good thing to do. Nobody is doing that. Everybody is sort of finding their way into this to cope with other things, or to sometimes it's recreational and gets out of hand. They get addicted to it. Anybody who's smoking a cigarette can probably tell you that. They started smoking to be recreational or be social, and next thing they knew they were going out because they had to have a cigarette. So it's not uncommon that people start into drug use to cope with something else. So if you're anxious and alcohol helps you settle down a little bit, or if you're depressed but cocaine or some other stimulant helps pick you up a little bit, then those things start, and your brain starts reacting to it and saying, oh, you know, that was pretty good. I think, would you do that for me again? And the addiction, which is a brain disorder, the addiction then is when the brain really starts rewiring, and the structure changes, and science has observed this, that the structure changes and the brain then starts demanding really that happen. Just like everybody here and everybody watching has probably eaten this morning. It's not because you looked on your calendar and it was time to eat. It's your body telling you and your brain telling you it's time to eat. I need to eat. Go eat. And if you don't for a while, it starts screaming at you. And the same is true with addictive drug use. That becomes its own issue. So then you have the two issues, the mental health on the one hand and the substance on the other. And 1 and 1 is not 2, it's 5. To help begin to unwrap all that and solve those problems. That's possible. We do that every day. Probably 90-ish% of the 4,200 people we saw last year have co-occurring mental health and substance issues. So it's very prevalent. And when I say mental health, what I mean is the all range of mental health, from schizophrenia and bipolar and all the others, but the predominant ones we see in our society, whether through the crisis response line, walk-ins, or just people that we're serving in other ways, that anxiety and depression feature is really predominant. There are other ways to deal with that. It's very treatable. But people find their way, you know, it's referred to as self-medication. And that shouldn't be judged as, oh, you're just going out to do this. It really is, they stumble into it and find, wow, that I feel better when I do that. And so then they do it again and again, and pretty soon it becomes its own issue. So opening those conversations up and understanding that this organ, just like all other organs, gets sick. and that it can be treated. And that's how we need to start thinking about this, as a health issue, not as a moral issue and something to be judged. Probably the key to your question, Joseph, is to the family and loved ones around need to keep the conversations open and keep the love coming. I love you. I'm concerned about you. I want to support you. Let's keep talking about this and keep that conversation open to help motivate that person to get into care. Because oddly enough, when somebody has these issues, they resist getting care sometimes. And it seems like, well, wait, why wouldn't they want to do this? Is this good? Are they having fun doing that? And it's not that. It's protecting that addiction. I don't want anybody taking that away from me, because I'm going to need that in the morning. And so that's part of that defensiveness. But recognize it's not a defensiveness to you personally. They're protecting themselves to continue that behavior. You can get through that, and that's what our team is for, that we can do it in a crisis response mode. We can also do it, our outpatient center is open access, so you can walk down and walk in the door and get served. And so you can get help today if you want to get that help. And to start that process and start that conversation and start to figure out how to unwrap all this with professionals who can walk you down that recovery path. That's important.
Question for Pat Condon. Both of the people linked to the cocaine sales on Monday, their bond was set at $1 million. Is that an indication of how seriously you intend to prosecute people who have been linked to sales that cause overdoses?
Well, one, I think it's in part just due to the nature of the charge itself. I mean, we're looking at, Class 2, Class 3, 1Cs, 1D felonies on some of these individuals, so they're looking at some significant time, and that's one of the things, is just the seriousness of the crime. Also, on any bond situation, you're looking at, what's their past history, have they shown up before? Those are all things that we use to go into setting the bond. The seriousness of the charges is always a consideration.
Can I ask the other Pat a question? Again, Pat, how long have you been, monitoring the situation, and what was the final, straw that made you take this kind of a drastic action?
Well, we've been monitoring this situation since the very beginning. When we first learned that these cases were occurring in the community, we've had ongoing communication and getting resources out, and we've worked directly with Chief Jackson and Chief Engler to make sure that information has been going out into the public over this period of time. And as now we're at this point where this has progressed even further, and we really felt it's critical that we really make the public aware of how serious this is. And I think our fire department and police department have been doing a tremendous job of trying to get the public aware of what's happening. But I think it's critical that they see all of us and know that we're all working together. So we've been working together since the very beginning.
You've all been and had these areas of expertise and been in these industries for a long time. Has it ever been this bad in Lincoln?
I'm going to let Captain Dave. Chief, yeah.
There's been other batches of bad drugs, so to speak, that have gotten into Lincoln that have caused a number of overdoses. But I think this is the most prolonged and largest numbers that we've seen. And of course, overall numbers of overdoses we're kind of shattering records here, which aren't records that are made to be broken.
Will any additional steps be taken to help reduce this? I mean, obviously the website is up. We're doing our part to raise awareness. Is there any other routes out of this?
I think our primary purpose even today is to elicit the partners that we've always come to rely on in our community to help us through this period of time. As I've said, we've had past overdoses in the past, and we've had past overdose deaths, but not to this degree, which is why we want to share it. We are looking at all avenues, all opportunities. We want to make ourselves available not only to you, the media, but to the public on thoughts and ideas. We would always recommend not to do illicit drugs. That would be our first recommendation. Don't do drugs. But we all know that's going to happen, and when it does, it is incumbent upon us to share information to say, if you're going to do it, here's how you do it safely, and that's our goal. But we have people dying, and that's a tragedy in any case. And our goal is to say, here's information, here's methods, and we're continuing to look for opportunities, however they come, whether they're national best practices or things that an officer on the street comes up with, or a firefighter or a care provider or somebody from the health department or prosecutor says this may work. We're all in when it comes to saving lives. So.
Why are these manufacturers of these drugs adding fentanyl if it's going to kill off their clientele?
Another thing I want to point out is that Captain Dale reported the number of reported overdoses. There have been many more overdoses in the community over the number that he's reported. Why do people do methamphetamine? I mean, if you knew how it was made, you'd probably pause and go, do I want to put that in my body? You look at this for addiction, for recreation, for dependencies, and people get addicted to a drug, and then they look at what can give me the next biggest kick. And so fentanyl can be that next biggest kick. And some people may not know it's in there. So that's the second advisor, is that know what you're using. If you're going to use, know what you're using. Because some individuals who are using cocaine, Narcan and cocaine has no impact because it's not an opioid. Cocaine and fentanyl, Narcan has an impact because it's impacting the opioid within the drug itself. So know what you're using, because if you don't, you could face that risk. So I don't know the minds of those that partake in illegal drug sales. Profit is one, but again, if we can get more people addicted to it, it doesn't take very much, and you can sell it. And so there's economics involved in this that they're involved.
Thank you guys so much for coming and covering this. We'll take a small break. If you want to stay for our daily media briefing, you're more than welcome to stay. Thank you to everyone for joining us, and we'll just take a quick break. You guys can take down your equipment or whatever you need to do there.